Health insurance is complicated, and it can leave people with a lot of questions.
I am turning 27 and have to buy insurance. What are these marketplaces, and what kind of plan should I get?
What is the difference between my copay and my coinsurance?
My husband was the only person that worked in my family, but now we are divorced. Can I still get Medicare?
One of my kids has asthma and seizures. How do I figure out the best health insurance for my family that I can actually afford?
Is Medicaid a good option for my family?
I have just returned from active duty. What do I need to do to stay healthy now that I am back home?
All of these questions can be overwhelming, and many people don't know where to find the answers. We propose 4 questions that every provider and patient need to ask, a shared conversation for health insurance access. The 4 questions are, what are my choices for health insurance? How do I get it? How do I use it? And how much will it cost me? We asked patients and providers our 4 questions, and many admitted they did not know how to answer. Here is what they said. What are my choices for health insurance?
HMO, PPO, Medicaid, Medicare. I guess that's private versus the government. That's about all I know.
Right now, I'm not too familiar with that. I know there's Medicaid, Kaiser, Cigna, PPO, HMO.
There's usually HMO, PPO. I think there's a third option, but I'm not sure.
How do I get it?
I might use Craigslist or something. There's different ones that you can go to.
I'm really not sure. I understand exactly how you go and choose, or what are the benefits, or what are the perks of one to the other. I'm a burro in general regarding health insurance.
If I'm not self-employed or I'm not employed by someone else, go to the health department to ask them what my options are.
When I was working, it come with the job. But when I became ill, my situation changed. My livelihood changed.
Well, I just shop it around. I'm not exactly sure how I'd go about doing it. I'm sure there's a number of search engines out there that can probably do comparisons.
I think I would start with my doctor. I think I'd start with my doctor and everything. By asking him about it. How could I get it?
How do I use it?
Well, I carry my card every day, and you really need to ask the experts and people who know more about this stuff. So it's your responsibility to really stay on top of it and be aware of it.
You've got this basic coverage, but until you actually need it and you're going through all of it, you've got to meet a deductible, your copay doesn't cover this. It's like, how do you understand it? Of course it's written in plain English, but that's not an understandable English. It's not an understandable language.
Basically to handle all my physical, mental, any type of care that I need. Prescriptions, vision, dental.
That's for medical reasons, and then it's also for, I would hope that the insurance would also cover burial plots too.
I use the insurance when the big problem, not small problem, that costs less than 1,000. I'm not gonna use my insurance. You think it's covered, but they're not.
So you use it whenever you need it, I guess, but you're always paying for it.
How much will it cost me?
Well, day to day, it would be whatever they take out of my paycheck, which would be the premium. Sometimes it's hardest to figure out is when there are deductibles in the plan, what the deductibles mean and what's covered in the deductible. And if I had questions about that, I'd probably have to ask the provider I'm going to explain that before I got there.
Well, it says it on my insurance card.
I don't have a quote off the top of my head, but government pays for me. I got the extra help.
Quite frankly, I just get a bill and I trust that my insurance company figured it out right, and I just pay it.
For like a standard plan, it'd probably be like $200 and something.
A couple $100 a month.
Maybe $160 or $200.
$130, $140 a month.
Close to $900.
$65.
$300 or $400 a month.
$130 a month.
It is no surprise that patients and providers alike need help understanding health insurance. Imagine, though, if we could all ask and answer these 4 questions and have a shared conversation. We will equip you to do this, but we need your help to start this conversation across our nation.